COVID-19 vaccinations work at varied levels of SARS-CoV-2 infection. According to a new study published on the medRxiv preprint service, vaccination efficacy varies depending on the level of exposure. The etiological agent of COVID-19, the severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, is transmitted by repeated and prolonged contact with an infected individual. The Centers for Disease Control and Prevention, CDC, advises that all those who have had close contact with an infected person, even if they have not shown any symptoms, should be tested promptly. Vaccine efficacy, VE, against laboratory-confirmed symptomatic COVID-19 patients with known contacts has been assessed in previous research. However, data supporting the hypothesis that VE for COVID-19 changes depending on the amount of SARS-CoV-2 exposure are insufficient. Outpatients over the age of 12 who reported an abrupt start of COVID-19-like illness and volunteered to be tested for SARS-CoV-2 infection were recruited in the present investigation. Flu VE, flu vaccine effectiveness, network data were utilized in this research to estimate COVID-19 VE. Study participants aged 12 and older who had been exposed to SARS-CoV-2 from February to September in 2021 were tested for VE against symptomatic laboratory-confirmed SARS-CoV-2 infections. Because of this, the data for this study was expanded by 4 months. Although the Johnson & Johnson vaccination or 2 doses of a messenger ribonucleic acid, mRNA, vaccine were given to completely immunized research participants, at least 1 dose of an mRNA vaccine was given to partly vaccinated individuals 14 days before sickness began. On the other hand, a multivariable logistic regression model showed that symptomatic SARS-CoV-2 positive patients were more likely to get vaccinated than SARS-CoV-2 negative persons. Additionally, researchers compared vaccination estimates based on self-reported vaccination status to those based on vaccination status confirmed by the CDC. Of the 3,384 people who had symptoms in this study, 2,229, 65.9%, said they had contact with someone who had SARS-CoV-2 in the 14 days before they got sick, 451, 20%, said they had contact, and 1,778, 80%, said they had no contact with someone who had COVID-19 in that time. SARS-CoV-2 was detected in 283 of the 451 individuals who reported contact and 331 of the 1,778 participants who did not disclose contact. Healthcare professionals under 65 who resided in a home with at least 1 kid under 12 years of age without verified COVID-19 immunization were the most common contactees among the 451 participants who reported contact. mRNA vaccines were administered to 93% of the 1,288 individuals, Pfizer-BioNTech to 59%, and Moderna to 34% of the subjects. The median time between the most recent vaccination dosage and the start of symptoms, regardless of the vaccine received, was 113 days for over 90% of those who were immunized before mid-May 2021. Pre-Delta and Delta variant onset periods were not significantly different in terms of contact status when individuals were stratified. Secondary SARS-CoV-2 transmission may have happened in any of these settings, but the results of this research are consistent with those of previous studies, which imply that households have a greater secondary transmission rate than any other context. Although the Delta variation predominates later in time, the data reported here suggest that immunization protects against laboratory-confirmed clinical disease regardless of a known encounter.